month is, thank you, Erica. This month is Healthy, Wealthy, and Wise, a Wealth Equity Conference. And we are so excited to have such a distinguished panel of speakers, actually several panels. We have a very full program. So I want to welcome all of you. Thank you for joining us. Hopefully a few more folks will be joining us as we go along. I'm looking forward to the content today that will be delivered by our guest speakers. And with that, I'll turn it over to our fearless CEO, Sonya Blake, to continue from here.
Thanks, Marianne. And I'd like to add my welcome to Marianne, to everyone who's joining us. And thank you so much, Marianne, for your leadership and your support at the Alliance. It's just truly invaluable. And we're so excited about today's event. The Valley Economic Alliance, for those of you who may not know, exists to promote economic development of our 5-city San Fernando Valley region. That includes the San Fernando Valley region of the city of Los Angeles, and it includes Burbank, Glendale, Calabasas, and the city of San Fernando. And what we do is a collaboration of a vast network of government officials, nonprofit leaders, and industry leaders pursuing job creation and retention, community revitalization, workforce development programs, promoting tourism, buy local campaigns, and so much more to really boost our economy locally. This, our Livable and Sustainable Communities Committee, convenes thought leaders on topics like housing, environmental sustainability, public safety, all kinds of quality of life issues that really impact our employers and our residents, whether they think of the Valley as a place they want to move to and a place where they want to stay and grow, where they've been planted. So we're very excited about the work of this committee. And we're pleased to present today's program, our Healthy, Wealthy, and Wise Wealth Equity Conference. So I'd love to encourage our members of our committee to register in the chat so that everyone can get to know them. If we have any elected officials here with us today, which we often do, I would ask you to raise your virtual hand so that I can see that on the Zoom tile and we can acknowledge you for being here. Also want to thank our generous sponsors who have helped us to put together this wonderful program. PacFed, Royal Business Bank, Bank of America, Union Bank, the San Fernando Community Health Center, UCLA Health. We have supporting us Century Housing, Jorgensen HR, the Child Care Resource Center, Kaiser Permanente, Colchin Ross, Black Women's Network, MidFirst Bank, Cedars-Sinai, and the San Fernando Valley Business Journal. And we're so very excited about all of our additional community partners and investors with the Alliance who really help us to do the work that we do. So to frame our conversation for today, just a comment and an observation. The Federal Reserve Bank, the central bank of the US, reported that the median net worth of American household incomes, the median net worth of American households in 2019 was $121,700. $121,700. That was the median net worth of American households. However, there's tremendous variation, whether it be by age, by location, whether in urban or rural settings. For example, the level of educational attainment, college degrees, high school degrees, the race, ethnicity. So for example, renters, African Americans, and people without high school diplomas all came in at under $25,000 in household net worth. So with 13% in the Valley, with 13% of our residents below the poverty line, and the median home price in April reported at $653,000, the San Fernando Valley region can sometimes be described as a tale of two valleys, the south of Ventura Boulevard and West Valley. And then there are some parts of the Central and Northeast Valley, which have received, some, for example, have received less investment, less amenities, less green space and services, et cetera, to create a better quality of life. So at the Alliance, we're not only pursuing a prosperous San Fernando Valley region, but an environmentally sustainable one and an equitable one. And that's what today is all about. So with that, I would like to introduce two additional speakers to help us to welcome and frame the conversation for today. Some leaders within our community, within our region, and within the nation, what they're doing to help equalize and create some more equity with regard to financial literacy, home ownership, entrepreneurship, and getting better, higher paying jobs so that people can have a better quality of life. So to start us off, I'm really excited to introduce Susie Trong, the Vice President of Consumer Banking and Market Leader with Bank of America. Our speaker bios will be shared in the chat. And so with that, I'd just like to say Bank of America has been a longtime supporter of the Alliance and a partner in delivering business assistance, workforce development, and other programs. And so very excited to hear from Susie. Thank you for being with us and help us to welcome our guest today, Susie.
So hi, good morning, good morning. I am super excited to be here today again. My name is Susie Trong. I'm the consumer market leader here in the East San Fernando Valley. It's a pleasure to be here and representing Bank of America and sponsoring the Valley Economic Alliance. So, some of the things that, Bank of America is keyed in on currently right now, first and foremost, our purpose at Bank of America is to make financial lives better through every connection. Some of the key things that Bank of America is doing today and ensuring that we stay connected with our community is first and foremost is refocusing our efforts within our community with the Boys and Girls Club. Last week for San Fernando Boys and Girls Club, we donated 72 backpacks. We will also be donating backpacks to the Burbank Boys and Girls Club as well. Feeding America is huge with us as well. Dodger Foundation, Malibu Triathlon, Mend, and much more. Some of the things that we have changed as well in refocusing with our clients is we have extended our hours from Monday through Friday 9 to 5 and Saturday from 9 to 4 with some of our financial centers. We have also reopened 10 to 15 financial centers in the greater LA area. A lot of our centers were closed due to staffing, so we have been staffing more of our financial centers currently right now. Also, in terms of the small business owners in our community, at Bank of America, we have been focusing on driving resources and information to help small business clients navigate what's happening now and prepare for what's next. We provide industry-leading advanced connections, tools, and solutions for small business owners, along with dedicated support to address their unique needs to banking, how, where, and when they want. We are top small business lenders. We continue to be among the nation's largest small business lenders, ending 2021 with $22 billion in total outstanding loans. Our portfolio of loans, deposits, and investments to more than 250 community development financial institutions, as a lot of us know, CDFI exceeds $2 billion. We deliver products and personalized care to help our 11 million business owners achieve their financial goals. Small business client benefits from our award-winning digital tools and advance of business advantage specialists in 2,400 financial centers. We also offer industry-leading private practice and merchant services. Our small business resource site, which shares helpful articles and tools, and Bank of America access to Capital Directory, a platform that launched in 2021 to help educate women-owned businesses. Our small business owner reports published every May shares trends and data on entrepreneurs' business outlooks and economic confidence. And those are some of the reasons why we sponsor the Valley Economic Alliance, but also want to start bringing leaders from our team and share their knowledge with you. So I know we'll be connected more. I'm super excited. I know you guys have been trying to get Bank of America out. So I've stepped in any financial literacy. I'm here and my team is here for it as well. Thank you.
Oh, wonderful, Susie. Thank you so much for your partnership and those great comments. It really helps us to see the importance of what's happening with our economy and the economics and the financial literacy of our constituency. So we really appreciate that and look forward to more interaction and collaboration. And, as many of you know, housing is a very important issue for many cities, of course, around the nation. And we're really looking at how we can help promote affordable housing with our committee campaign, Housing Creates Communities, among other efforts. And we're so excited to have Century Housing in our network and one of our partners at the Alliance. So with that, I'd love to have Beulah Koo say a few comments, talk to us about housing. Beulah is Vice President of Client Relations with Century Housing and one of the leaders in housing and affordable housing space. And so Beulah, if you wouldn't mind sharing with us, what are you seeing with regard to housing and what might you like to say to welcome our guests today?
Well, good morning. I'm Beulah Koo, Vice President of Century Housing. I'm delighted to be here. Welcome you this morning to this special conference. For those who are not familiar with Century, we are one of the leading CDFIs supporting quality affordable home development throughout California. We provide statewide financing, develop multifamily housing, and manage a variety of multifamily units in Southern California. During the past 27 years of service as a nonprofit, Century's work resulted in more than $2.4 billion in financing, over 60,000 workforce homes, more than $900 million in capital under management, and created thousands of construction jobs every year. And I'm sure you're all aware that homelessness is a top issue among voters and citizens over the past few years on the lack of affordable housing and renters being priced out of these existing homes. The reality is that most people living in California, specifically the major cities, including LA and San Francisco, are cost burdened, which means that close to 60% of the renters spend more than 30% of their income on housing expenses. Surging rents are putting millions at risk of experiencing homelessness and close to 25% of the nation's total. The average rent for the apartments in Los Angeles in 2022 is $2,600 versus $1,100 in the US. And in the national average ownership, there is 64.8% in 2020 versus Los Angeles County with an average of 46%. Experts believe we are facing a housing crisis that touches most communities across the country. 70% of Americans believe that the younger generations are having a very difficult time purchasing their homes as opposed to previous generations. But with the passage of Proposition HHH, a 2016 ballot measure approved a $1.2 billion obligation funds to develop and acquire supportive housing, which is approximately 10,000 units in 10 years. However, most citizens don't know that it takes between 3 to 6 years for developers to complete a project. It costs approximately $750,000 per unit for supportive housing. After the Proposition HHH passed, 11% of the projects were completed by 2021, but there was a 45% increase in homelessness since the passage. Most of the projects are set to be available between 2024 and 2026. The LA Housing Department shows 125 HHH projects, 7,900 units being created and in construction, and 6,500 supportive housing. However, the projected total of 10,000 units will be available around the end of 2026. Century Housing has helped finance 25 of the 125 properties in total. Therefore, there is a housing crisis and a crisis of drug addiction, mental illness, and food insecurity. As a concerned citizen in our communities, we encourage you to contact your officials to support both new housing initiatives as well as asking officials to fund more for health needs. And I hope you enjoy the rest of today's program. And thank you so much for inviting me.
Wonderful, Beulah, thank you. Thank you for those insights and comments. Really interesting information, very helpful. We're so thankful to have Century Housing with us and appreciate your time today. With that, I'd like to pass it over to Marianne Haverhill, Chair of our Livable and Sustainable Communities Committee, to introduce our first panel on healthy.
Great. Well, thank you, Sonya, and thank you again to our sponsors. We will be providing the bios of our speakers in the chat, so I won't take time to spend a lot of time introducing them. But we'll start with Amy Wiese from Kaiser Permanente. And I happen to know that for a number of years, Kaiser has really been focusing on the social determinants of health. In other words, beyond seeing the doctor regularly, beyond exercise, good eating, there's a lot of other factors that impact people's health and well-being. So maybe, Amy, you could share with us the relationship between health outcomes and economic security.
Wonderful. Can you guys hear me okay? All right. So thank you again, Valley Economic Alliance, for having me today. I'm Amy Wiese, and I'm the Community Health Manager for Kaiser Permanente. And many people may not realize that Kaiser Permanente is the nation's largest nonprofit integrated healthcare system. So we have a social mission to provide high quality and affordable healthcare services and to improve the health of our members and the communities we serve, which is where much of my work takes place. And that's why I see many of our partners throughout the years on this call. Much of my work is partnering with Valley Economic Alliance or organizations supporting business, school districts, nonprofits, government agencies, but much of that cannot be, and the work that I do cannot be done alone. So thank you again for having me today. I've been asked to share a little bit of background on the why and how economic security and opportunity or lack thereof affect a person's health. We know at Kaiser Permanente that housing stability and food insecurity, as well as physical, mental, and social health, really affect the health of an entire community. For example, support for under-resourced business owners of color, which Sonya was just talking about, for example, can change the trajectory of not only individuals or families, but their entire communities. Across the US, too many people are having difficulty meeting basic needs, which we know has been exacerbated by the pandemic. Roughly 40 million people each year cannot reliably get enough affordable, nutritious food, including 1 out of every 6 children. In addition, about half of low-income Americans struggle for paying housing, which we know is even higher than the national average in California, and certainly in the San Fernando Valley. We can't talk about economic opportunity without acknowledging that disparities exist because of racially discriminatory policies and practices, both historical and current. People of color tend to face greater economic challenges and have worse access to healthy food and affordable housing. These challenges impact health, and research has linked lower levels of income and wealth to health. Problems such as obesity, asthma, mortality, poor access to healthy food increase the risk of health conditions such as diabetes, depression, and hypertension. Housing instability, as you can imagine, lead to physical health problems, harm mental health, increase healthcare utilization. Poor mental health and hardship consistently leads to the experience of financial hardship, and poverty is often cyclical. Middle-aged and older adults who experience a negative wealth shock had a significantly increased risk of mortality compared with those who have continuous positive wealth. Health outcomes and health disparities are shaped by people's ability to meet basic needs, which itself is shaped by whether individuals and families live, work, and play in environments that offer economic opportunities, affordable housing, healthy food, and support that enable and promote good health. In the public health field, Mary mentioned it, we call these social determinants of health, which is why Kaiser Permanente and many other healthcare organizations are focused on addressing these determinants that really focus on what's happening upstream, not what we're just seeing in our doctor's office or in our ERs or in our hospitals, but what's happening outside the 4 walls of our medical facilities. The racial wealth gap certainly affects every aspect of economic activity when it comes to employment, income, education, savings, and investment. And the lack of financial cushion for poor financial circumstances results in far worse financial consequences from the Great Recession, and certainly what we've seen from the economic slowdown from the pandemic. Many of these financial inequality and financial insecurity have direct and direct consequences on health, particularly mental health and chronic stress, which I know some of my colleagues are going to talk about. And of course, we know that low-income people are more likely to face food insecurity and housing insecurity, which brings their own related health consequences. We know from our own Kaiser Permanente community health needs assessment that the median rental cost in San Fernando Valley is much higher. We talked about and have heard some of the statistics around housing. Having a high school diploma certainly correlates with strong and healthy behaviors and improved quality of life and higher life expectancy. And children from families from low income are less likely to experience the numerous benefits of attending preschool, higher rates of high school graduation, and college attendance. All of this to say, I know we're at 5 minutes, but all of this to say that there's a lot that we can do together. There's definitely some work that we've been doing with Valley Economic Alliance. Hopefully you've seen some of the work that the promotion of one-on-one business consulting through Pacific Community Ventures that they've been promoting, that has been supported by Kaiser Permanente, and a variety of other programs that Kaiser is looking to partner on. So with that, I'm going to go ahead and turn it over to my other speakers. You have my information in the chat because at the end of the day, all of this cannot be done alone. We need to do this in partnership with all of you. So look forward to working with and speaking with you more. Thank you.
Thank you so much, Amy. That was terrific. You mentioned this, but for years, mental health has kind of been under the radar, not well recognized, but I think the pandemic really brought to light the critical need for mental health treatment. So we're glad to welcome Karla Flores Lagunas today. So maybe you can address this question about how mental health providers are meeting this critical need within our society.
Thank you. Hi, everybody. Thank you for letting me join and talk with you today. I'm going to show some slides. Get your phones ready because I'm going to have a lot of resources. And right now, everybody's got mental health needs. So I'm sure if it's not happening with you, it's happening to somebody you know. So just get ready to share some information. So give me a second. Okay. Perfect. Okay, so I'm going to talk, my name is Karla Lagunas, I'm a licensed clinical social worker, and I'm going to talk about, in general, what are all the different levels of healthcare, and then I'm going to apply it to the services that we offer at UCLA Health. So since the pandemic, we've been slammed. I've been so busy. We started doing really aggressive community outreach. We are doing presentations like this one. We have a newsletter that we send out to our members. We work with parents, having parenting classes. I know some of my colleagues do parenting classes with the Child Development Institute in Canoga Park. So we try to catch people that aren't even connected with us through these programs. And we also, like Kaiser, we have an integrated healthcare system. And so what that means is that at every visit with primary care providers, PCPs are screening for any kind of depression or anxiety, and then discussing mental health care and making referrals for therapy or for psychiatry or both if it's warranted. We also offer outpatient therapy. And what outpatient therapy is that if you're struggling with working, if you're struggling with going to school, if you're having problems at home, if you're having problems socializing, and you need some support, outpatient is for you. Outpatient usually can happen individually where you're meeting once a week, you're meeting in a group setting. One of the things that we've done during the pandemic is we've greatly expanded the number of groups. I specialize in perinatal mental health. And so I went from having a couple patients to tons of people experiencing perinatal anxiety and depression. And so now I have 2 groups going every week to try and meet this need. We've also expanded out into working with community providers to expand access to care because maybe you decide that you need therapy, but a real struggle is finding a therapist that has availability. And so that's been something that we've been working on and expanding. When people are in crisis and they're having difficulty functioning, maybe they're not going to work, maybe they're not going to school, maybe they're having really upsetting thoughts, intensive outpatient would be the place for you. We have several intensive outpatient programs in our organization, and they focus on different things. We have IOPs that focus on perinatal mental health, on OCD. We have programs for teens, for adults, older adults. The next level of care is called partial hospitalization. And what happens in partial hospitalization is you are at risk of hurting yourself, but you're not an imminent risk, and you would benefit from more support. So what happens in partial hospitalization is you go to the program, you would be there every day. During the pandemic, and we still continue this option, we offered a virtual option where you can participate in groups, you can have therapy, you can have psychiatry to keep you out of a hospital. Now we also have a hospital and we also offer emergency care. And so when these programs are appropriate is if you're having thoughts of harming yourself, when you're having thoughts of harming someone else, and you're having a plan of how you would do it. So what happens in inpatient hospitalization and emergency care is you get evaluated for safety. And if you're found to be in danger, you will be put in an inpatient hospital. Usually they start medication and they monitor you until they make sure that you're safe and you're ready to go home. And then you go down to one of these lower programs. And something that's really exciting that just started is last week, they started a suicide hotline. This is a national number, so put it in your phones. 988 is the suicide hotline. You can call it 24/7. And when you call the suicide hotline, you get connected with a counselor. They can help you talk about mental health. They can talk about substance use. And this would be for yourself or somebody that you care about. Okay, so this is the time to have your phone. So if you're a UCLA Health member, you might have heard about our program already. Our primary care providers, like I said, screen for programs. I work for Behavioral Health Associates for a short-term treatment program. We provide services over 12 to 20 sessions. We see people over Zoom. We see people in our offices. We see everything from kids to older adults. We also have partnerships with therapists and psychiatrists in private practice. What happens is that we have an outreach coordinator that builds new relationships. We run background checks and we create agreements with them to take our patients. And we also do community outreach.
Thank you, Karla. That's 5 minutes. If you want to
Okay,
finish your thought.
take a picture of this slide. This is our Semel Institute, and this is the last thing I'll say. This is a list of specialized clinics in our hospital. So take a picture of this one really quick, and then this last one. This is how you get a hold of me. I will be available if you have questions. Put it in the chat, and I will be happy to answer them. Thank you.
Thank you so much, Karla. That was terrific and good to hear about all of your services. So if you listened to the news this morning, you probably heard that our president, Joe Biden, now has COVID. So there was a flurry of news reports all about COVID prevention, treatment, what's happening, all that kind of stuff. Well, we're glad to have with us Dr. Jeffrey Salberg from Cedars-Sinai, who will, I guess, really address what's happening with COVID at a local level. So thank you very much for joining us, Dr. Salberg, and we look forward to hearing from you.
Good morning. Thank you for including me in today's program. I'm here to talk about a COVID update, and I'm hearing a little bit of feedback on the audio. Are you hearing me all right?
Yeah, sounds good now. Thank you, Doctor.
Okay. So this morning, as you know, President Biden was announced that through the White House that he is testing positive for COVID-19 and has mild symptoms. That's certainly topical for today's COVID update. You'll be hearing a lot throughout the week from experts about his condition and the general treatment of COVID in patients in his age range, as well as the rest of the general population. And topics that will be touched on will be including the diagnosis, the symptoms, the various treatment options, and how it's managed today as opposed to how it's been managed earlier in the pandemic. I'm going to use a slide presentation to sort of touch on some of these topics. First, what I'd like to do is just touch on what we're dealing with currently. These are statistics that came from LA County regarding the number of cases that are currently being reported. And you can see that just a few days ago, there was almost 4,000 cases that were being reported. That's probably a severe undercount of the actual number of cases that are actually occurring in our communities. The estimates are actually that it could be 7 to 10 times as many people that are being diagnosed with COVID through home testing, because most of the tests that are being performed by people with the rapid antigen test that many people have in home are not being reported to the county health statistics. And as a result, that's a severe undercount. There could be as many as 10 times as many cases that are actually occurring because of the rapid transmission and the nature, the infectious nature of the current Omicron subvariants that are circulating in our communities. And the most noted one is this BA.5 subvariant that is the most contagious yet of all the very contagious strains of coronavirus that have been circulating in our country since the onset of the pandemic 2.5 years ago. The testing that's reported is also being underreported in some respects, because if people are doing home testing and are not being officially counted, of course, the number of tests being performed is much higher than would be reflected on this graph. The most telling statistic is the one that is the testing positivity rate. Among those tests that are being reported and recorded, it's significant to note that there's an increasing number of percentage positive tests, meaning for all the people that are being reported to have taken the test, the number of average number of positive tests that are being reported have increased now to between 15 and 16% in our community. And that's a significant elevation in the number of cases of COVID-19 that are occurring. And as a result of that increased number of cases, the LA County Public Health Department is considering reinstating a mask mandate for indoors in LA County, and that decision will be made based on the statistics of how many cases are being reported and the testing positivity rate. Probably by the end of this week or beginning of next week is when they're going to make that determination. Many patients wanting to be extra cautious are already wearing masks indoors because of the high transmissibility of this BA.5 subvariant of the coronavirus. The next slide is a series of graphs that talk about deaths in LA County. Obviously, the good news is that the number of people dying from coronavirus is way down. In fact, the number of cases of deaths occurring from coronavirus has actually decreased, while the number of cases has been increasing due to this subvariant. What that means basically is this is a much milder infection. And the reason for that is multiple. One is that most people have been exposed and been infected with different subvariants or variants of the coronavirus over the last 2.5 years, giving them some natural immunity. The majority of people in Los Angeles County have been vaccinated. Upwards of 70% of people have at least received one vaccination, if not two, and are fully vaccinated by that definition. And many of those patients have gone on to have at least one booster shot. So the more shots you've gotten in terms of vaccination, the more protected you are from the ultimate penalty for being infected with coronavirus, which of course is serious illness and death. The death rate going down is somewhat of a comfort given the large number of cases of people coming down with coronavirus. So what exactly is happening is that there's an increased number of cases being reported and that we're experiencing as outpatients, but a relatively small number of patients are actually requiring hospitalization, and an even smaller number are actually dying from the disease. The number of hospitalizations is going up though. About 6% of inpatients in LA hospitals have a diagnosis of coronavirus, but many of those patients were admitted for other reasons and had concurrent infection with coronavirus, not necessarily the main reason they had to be admitted. Those patients that have the most serious outcomes, the most serious illness from coronavirus are still the unvaccinated. People who have not been vaccinated have the greatest risk from this infection. And so we're still trying to push that anyone who has not had a vaccine yet for the coronavirus is strongly encouraged to have that vaccine if they don't have any strict medical reasons not to take it. It's your best protection against serious disease from this infection. The number of vaccines is increasing. The original vaccines were these mRNA vaccines that were approved by the FDA back in December and January of 2020 and 2021, specifically the Pfizer and Moderna vaccines. These are called mRNA vaccines because what the component of the vaccination is that makes it work is a piece of genetic material called mRNA that codes for a specific protein on the virus. Our muscle cells in our arm where the vaccine is injected take up that mRNA. That mRNA is then used by the muscle cells to manufacture the spike proteins that are on the surface of the coronavirus. And those proteins then are released into the circulation and stimulate our immune system to make an immune response that protects us from the real virus. The mRNA that's taken up in our cells is rapidly degraded after the initial production of the spike protein, so it doesn't stay in our body. It basically is processed by our cells in our body and disappears. But the immune response to the proteins that have been manufactured by our own muscle cells then have a lasting effect on what we call our memory T cells, the specific white blood cells that recognize the virus when it infects us later and protects us against serious illness. Another vaccine that was approved subsequently was the Janssen or J&J vaccine. It's a different type of vaccine, works a little differently, was originally promoted to be a one and you're done type of vaccine where you take one vaccination and you're protected. But as it turns out, it does not work that well for long-term protection and needed a booster, a second shot, and then boosters after that, preferably with an mRNA vaccine. There are basically a fourth vaccine now has been approved tentatively by the FDA by a company named Novavax. It's yet a different mode of action. It's a protein-based vaccine that stimulates our immune system to recognize the spike proteins from the coronavirus and build antibodies against that. It appears to be a very effective vaccine as well, 90% success rate in its clinical trials, requiring 2 shots approximately 4 weeks apart.
Excuse me, doctor, I'm so sorry, but we are out of time. If you would like to finish your thoughts, we really very much appreciate the presentation.
Okay, well, we'll just flip through a couple of slides here that just basically say there are multiple clinical trials going on right now to see which treatments are the best. Again, the symptoms of coronavirus, the subvariant is relatively mild, and you'll be hearing a lot about those symptoms as the president continues to mend from his infection. He's being treated with Paxlovid, which is the oral antiviral that's been approved since December of last year for treatment of patients and anyone the age of 65 or older and is symptomatic with less than 5 days worth of infection should be considered to possibly deserve treatment with that. And the president has been started on that drug accordingly. You should be in touch with your primary care doctor to discuss whether that drug is suitable for you and whether or not timely treatment could be started. If you have any questions, I'll be happy to take them in the chat. Thank you for asking me to present today.
Wonderful.
Thank
Thank
you.
you.
Okay, thank you, Dr. Salberg. How much time do we have for questions, Sonya?
Oh, yes, Marianne, great question. So we will do Q&A in the chat. So participants who have questions, type those in the chat, and we would ask our panelists to go ahead and answer those questions there. Wonderful. So it's time to move on to our next panel. And I thank you so much, all of our panelists and Marianne for facilitating that. So we talked about healthy and how we need to be healthy and how that affects our economic well-being. Now we're going to talk about wealthy. Let's get into some economics and how we facilitate equitable economic development for our region. With that, I'd like to start us off with Daniel Schneider. So Daniel is the Los Angeles Coast Area Research Manager of EDD, our Employment Development Department of the state of California. And my question for you, Daniel, is what would you say are the highest paying occupations that we're currently seeing in the Valley area, or as close to the Valley as you can talk about, which require the least amount of educational attainment? That way we can get as many folks as possible, bringing in some commanding higher wages and salaries and being able to make a living for their families. Daniel Schneider, thank you so much for joining us.
Great. Thank you, Sonia. I think you made a great point in your question, and I'll just start with that caveat. You said as close to the Valley as you can get. So we know the Valley is a regional designation composed of many cities, parts of the unincorporated part of the county, and sort of the big elephant in the room as far as we're concerned with statistical data is Los Angeles City, right? So much of the Valley is part of LA City, and very difficult for us to tease that out without doing some very specialized data. So bear in mind, a lot of my research here is being dragged by LA City as the sort of the main poll, but we will do some special Valley look at the end of the analysis here. All right, so it's a great question. What are the highest paying, lowest barrier to entry occupations? Something every job seeker wants to know, right? So to get a little bit more detailed than that, I didn't want to look at just the occupations that pay the most and have the least education, because some of those jobs, there's only a few of them, or they're currently in decline. So I added a couple of additional filters there to make sure that we're looking at not just jobs that pay well, don't require a lot of education, but also are growing and have a large number of openings in the local area. So with that, once we apply those filters, we came up with 5 great occupations that are available here in the San Fernando Valley. So the first are electricians, second, carpenters, then are licensed vocational nurses, painters, and fitness trainers and aerobics instructors. So we have a good diverse selection here in the healthcare industry, our other services industry, and as well in construction. Now, taking a look at these occupations in more detail, a couple of things that I want to draw your attention to. As I think Marianne and Sonya mentioned, this will be available, so I'm not going to read all the information here. But a couple things to note, right? All of these occupations, with the exception of our LVNs, only require a high school degree or less. And our LVNs are looking for a post-secondary non-degree award. So that's a certification that takes 6 months to a year. So not a huge amount of investment up front. Another thing I wanted to make sure is that these don't require a large amount of work experience. So some of our higher paying low education jobs are supervisory and managerial positions that require a lot of work experience to enter those occupations. And then on the far right-hand side, you'll see that with the exception of the LVNs, most of these jobs do require some on-the-job training in the form of apprenticeships or sort of less structured on-the-job training. And that's great, right? Because that gets you into a high-paying job, but gets you started making money as you're training. 2 other things I want to draw your attention to. Said these are the highest paying jobs. That doesn't mean that they're all gonna be, each job themselves is going to be paid a lot. We're looking at our median here, and even our fitness trainers and aerobics instructors, median is $52,000 a year, which in LA may not be that much, but it's a good place to start. Another thing I want to draw your attention to is over the next 10 years, each of these occupations we're expecting to have 10,000 or more openings in LA County. In the case of carpenters, as many as 26,000 openings. So I wanted to look at what was actually out there and what do these advertisements look like in the Valley. So we're starting here with our electrician jobs. Couple things I want to draw your attention to. First is the full job description. which is looking for an apprentice, right, with strong work ethic and positive attitude, and no formal experience is necessary. And the other thing to note is the salary ranging from $16 an hour, which is now the minimum in LA County, up to $35 an hour. Something to keep in mind, we are in a strong labor market for workers right now. So when you're getting that initial interview or job offer, good time for negotiating a higher salary. Now, when we look at electricians over the last 11 years, we see very strong growth in job demand. In our San Fernando Valley cities, the number of job ads per year has grown from less than 100 per year to over 600. And then when we look at the advertised salaries, many of them are in the $75,000 a year plus range. Now, on the other end of the spectrum, looking at fitness trainers, we found a job here located in Calabasas, again with that salary in the $16 to $33 an hour range. And again, looking for no prior fitness experience or fitness education, and they'll fully certify you with extensive in-house certification. Similar trend here, a large upward trajectory in job demand over the last 10 years. We do see a small downward tick in 2020 for obvious reasons. And then a lot of highly paid fitness trainer jobs advertised in the Valley. So I would encourage anybody who's interested in this kind of information to go ahead and look at our website, labormarketinfo.edd.ca.gov, just barely scratching the surface here. And there's a lot more to be seen there. Also, feel free to contact me or my staff that are located in the Valley and Los Angeles area. All right, and that'll do it for me. Thank you.
Daniel. That was great information. Thank you so much for telling us so much in such a short amount of time. It's really very helpful. Appreciate that. And any questions for Daniel, please do put those in the chat and we'll get to all of those. At this time, I'd like to introduce Dr. Barry Gribbons, who is president of the Los Angeles Valley College. And Dr. Gribbons is a member of our board of directors and co-chair of our education and workforce development committee at the Alliance. And we're so thrilled to have your expertise with us, Dr. Gribbons. Love to hear from you, from your perspective, what kind of vocational training programs are offered at our community colleges to help our residents get into higher paying jobs quickly. Dr. Gribbons.
Thank you, Sonya. We do have quite literally hundreds of options available to folks to get into good jobs that pay well at Mission Valley, Pierce, and Glendale in particular here in the Valley. You can see the number of programs, so perhaps we can post into the chat a complete list of all the programs that folks can sign up for. There are a lot of different ways that the programs are offered, so I want to just comment for a moment about those different options. Everyone is familiar with credit courses, so courses that apply to or where you earn college credit towards a degree or certificate and help transfer to CSU and UC. Most of our occupational programs are also transferable to CSU and UC, so it helps folks get a job as well as folks who want to continue their education for a bachelor's to do that. We have another category of courses, non-credit, so courses that are strictly intended to help develop skills. A really nice thing about the non-credit courses is that they're free, and Mission Valley, Pierce, and Glendale all offer non-credit courses. In many of the courses, everything that we're doing, of course, that can be done online is now available online. Oftentimes, folks can have both online and in-person options, and it ranges from different amounts of time. Some programs are very short-term, like at Valley, we have a program to help folks quickly get some skills in manufacturing and machinists in 6 weeks. And then by the time that folks finish the training, actually most folks receive job offers or programs that go all the way to a 2-year program. To give you a sense of just a few, most colleges offer programs like computer programming, computer networking, graphic design, accounting or bookkeeping, real estate, English as a second language, photography. Many of us have RN programs that are very, very popular, or LVN to RN programs, child development and EMT. Lots of these programs, in particular nursing, pay extremely well, and folks are very much in high demand. It's oftentimes really hard for folks, for hospitals and other clinical sites to find enough RNs. And each of the colleges do have some unique programs as well. For example, at Valley, we have manufacturing that's not common with the 4 colleges, broadcasting, journalism, respiratory therapy, and we're applying to be able to award a bachelor's degree in respiratory therapy actually now too. So that'll be going through the process in the next month or two. And then what we're calling 21st century skills, those are oftentimes thought of as the soft skills that employers are looking for employees to help them be effective. Mission, on the other hand, is a terrific college for culinary. They have lots of wonderful apprenticeship programs like overhead line worker and mechanic. They also have a lot of wonderful hospitality programs, hospitality courses as well. Pierce is very well known for their agriculture program, as well as they have an auto repair program that's terrific, floral design, retail management, ASL, which is another terrific program for getting jobs. And Glendale has some unique programs as well: addiction studies, flight attendant, pilot, dental and medical office, tax preparer, just to name a few. So just to emphasize again, there are a lot of different options in the California community colleges, the 4 colleges in particular, quite literally hundreds to prepare folks to get jobs. Much of the training can happen very quickly in just 6 weeks. A lot of times we have single courses that folks can build on so they can immediately start developing some skills and then grow it from there. So lots of terrific options for folks. And I should also mention the 4 colleges, Valley, Mission, Pierce, and Glendale, love partnerships, and we all love to hear what we can do differently. So additional programs folks would like to see us offer. We'll be happy to develop anything that there's a demand for. Thank you.
Wow, wonderful. Great, Dr. Gribbons. We're so glad that we have a jewel like LAVC and all of our 4 community colleges and our universities as well, right here in the Valley and available to our residents. So thank you for that terrific presentation, and we'll have all that information available for folks as well. So once folks are trained, in these wonderful burgeoning occupations, financial literacy is really crucial, right? What do we do with our earnings? They say it's not how much you make, it's how much you keep, right? So we want to be very wise with our money management, our credit and money management. And so we're so thrilled to have with us a partner, Operation Hope, from Operation Hope, Monica Seda, credit and money management well-being coach with Operation Hope. So Monica, we would love for you to share with us, if you can, come on video if you have that available. We'd love to see you and hear from you on the question around what are some of the basic principles of financial literacy and investing that the average Valley resident might most benefit from knowing. So Monica, if you would share with us about financial literacy, please. Monica, are you there? Monica Seda, I know I saw you earlier. Oh, maybe she hopped off or dropped off for a minute and will come back to us. I sure hope she'll come back to us. What we're going to do is we're going to go to our 4th panelist on the wealthy portion of our Healthy, Wealthy, and Wise, and hopefully we can come back to Monica or at least provide some handouts from what she would have said in her comments. Another piece of the puzzle, there are so many different avenues to financial well-being. One might be investing, of course, having a good paying job. A lot of folks build their financial portfolio through business ownership, which we'll talk about a little later on. One way that many of our residents find as a pathway to financial self-sufficiency is home ownership. And as many of us know, we do have a housing crisis going. We have incredibly robust housing market with high home prices right now in terms of rental and acquisition of homes. But there are resources available. So I'm very encouraged by our next speaker, Fernando Garces, who's with MidFirst Bank. So Fernando is the Community Development and Mortgage Lending Officer with MidFirst Bank. And he's got a really interesting program that could be very beneficial for some folks to help them get into their first home. So Fernando, we know that home prices are at all-time highs in our region, and as they are in other highly desirable metro areas like ours. What can you tell us about whether or not and where home buying can be within reach for low to moderate income renters in the San Fernando Valley region? Fernando, welcome.
Thank you. Well, I am the mortgage doctor. So who's MidFirst? Let's talk about that really quick, because it's not a name brand that a lot of people in the San Fernando Valley know. MidFirst Bank is a privately held bank based out of Oklahoma with markets in Los Angeles County, and that includes the San Fernando Valley. Our mission, our objective is to offer mortgage solutions for first-time home buyers that are sustainable and build community. So that we have a track record of doing that, and we're in the market here in Los Angeles to offer sustainability to our customers. And one way we do that is through offering low down payment loans, home first mortgages, with sustainable monthly payments. Now, just so you know, you had mentioned earlier that the average home price in properties east of Ventura Boulevard are around $653,000. The traditional requirement for a home loan would be 20% down, and that equates to about $130,000 worth of monies to be put as down payment. What we've noticed is not many people who are purchasing their first home have the luxury of having $130,000 to put as a down payment. So that might take them out of the ability to purchase a home. We in turn have developed a product that can help buyers purchase a home with as low as 3% down. What we've done, what that equates to is about $20,000 or so in down payment on a $653,000 home purchase, with about $10,000 in closing costs. That equals to around $30,000 worth of monies to lay out to purchase a home. That's substantially within the reach of a lot of people versus the $130,000 down payment requirement. What we've done with our product, which is unique, is that not only have we offered the low down payment, but we've opened it up to a lot of different borrowers. Typically, most grant programs require borrowers to meet minimum or maximum household income requirements. We don't have any of those restrictions. So we understand that it takes about 2 incomes to purchase a home in LA County, and we didn't want to restrict borrowers to have a maximum income requirement. So we've opened it up. Our program is unique also in the sense that we offer the ability to maximize or utilize more of their income. And what that means in our world is we'll let people use over 50% of their gross income to purchase a home. Most traditional banks will lay it out at 43 or 45%. So we've upped it a lot. We also have made not a crime, let's say, to put low down payment by not requiring mortgage insurance. Mortgage insurance is an additional cost to low down payment loans under 20% or above 20%, I should say. So we've had a lot of flexibility. Our underwriting requirements are huge. We've just started introducing I-10 borrowers. So those people who are looking to gain residency here in LA County, our program is LA County specific, the ability to purchase a home. So we've been seeing an uptick on people that are here trying to gain residency, that are working and have built credit and would love to purchase a home. So we've done a lot of different things to offer affordability, sustainability, and the ability to reach the American dream.
Wonderful. How exciting, Fernando. Really.
Oh, what important thing? The
Yes,
most
yes.
important thing,
Please.
$15,000 grant assistance. So what that means is I gave the example of $30,000 that a borrower would have to put in on a $653,000 purchase. We'll give them $15,000 to put towards that cash requirement to purchase. So that means that out of pocket would be about $15,000. That clearly is within the realm or in the reach of a lot of borrowers. So we've been able to see a big uptick. Now, in terms of the market, and I'll be very quick here, yes, the market is sort of settling down and prices have actually come to a good level. And we're seeing that our first-time home buyer activity is actually increasing because more of the seasoned buyers are sort of like, are stepping back. So we've actually seen an uptick in applications on the first-time home buyer.
Awesome. That's really exciting. Yeah, I was going to ask you about that $15,000 grant. So I'm really glad
Right, the most important thing.
how that fits in. Thank you, Fernando. That was very helpful information. We're really excited to get that out to our network to enable more people to take advantage of that.
Thank you so much.
Yes, I would like to thank all of our panelists for the second panel on wealth, which is Daniel, Dr. Barry Gribbons, and Fernando. Thank you so much for that information. Monica's having trouble reconnecting with the tech, so hopefully if she comes back, we'll be able to hear from her. If not, we will make her handouts available on our website at thevalley.net/healthy, which is where you registered for this event. The replay and the handouts will be there at thevalley.net/healthy. So at this time, I'm going to turn it back over to Marianne to introduce our third and final panel. Again, our program goes until 11:30, not until 11. And Marianne, if you wouldn't mind introducing our third panel on Wiese.
Great, thank you. Well, another negative impact of the pandemic was that I kept reading reports, many of us probably did, about childcare centers closing and childcare workers leaving the field for other better paying jobs and so on and so forth, which was especially onerous for essential workers and low income workers who could not work from home. They actually needed to be on site when they did their jobs. So we're hoping that Mike Olenick can share with us what's happening in his field and what improvements are being made. I'm sure there are many. So thank you, Mike, for joining us today, and we look forward to hearing from you.
Well, thanks, Marianne. It's nice to see you. It's been a little while.
I know, we need to reconnect, coffee or something.
I know. So, you know, when people think about childcare, for many, many, many years, that was something that families were supposed to take care of, and employers really didn't pay much attention to their employees' childcare needs. There have been a couple of times when the government has gotten into providing some support for childcare. World War II, in order for women to work while their significant others were off fighting the war, there was a big investment in childcare. The war ended, and that investment pretty much ended, except in California. In California, the state started providing some funding for some of these centers that have continued all this time, run through the schools. And in 1978, Jerry Brown, the first time he was governor, said, oh, you know, it's a lot of money to pay for these centers and maybe if we just put vouchers out to the parents, we could get more parents to pay for childcare and support the lower income parents who are the working poor to do that. Then there was the welfare reform that happened in the late 90s, in which President Clinton said, if we don't provide childcare for very low income folks who are on welfare, we'll never get them off of welfare, and so we'll pay for their childcare. That program continues to this day. If you have a person who was on welfare who has kids, they can get childcare paid for as an entitlement. And we administer those programs. We also administer a program, a voucher program for the working poor. And that program has grown over the last 2 years by 400%. And so we actually right now are enrolling families to pay for childcare. And if your income is less than $82,000, you're a family of 3, you're eligible. If your income is less than 93,000 and you're a family of 4, you are eligible. And so we are enrolling, and I think I have a share thing I can put up. Here we go. So if you have employees that are making less than that amount, we can help pay for them. At the same time, you heard Daniel Schneider talking about the rates, sort of the median rate of pay for people who don't have a lot of training. Most of the people that are taking care of our kids have much more training than that. Most of them have AAs, a lot of them have BAs, and yet they're the poorest paid people out there because most of it is based on what parents can afford to pay. And most parents can't afford to pay the price of childcare because it's actually more expensive now than college tuition. And so there have been a number of initiatives to try to reduce the cost of care for those parents who are paying the full cost. And we're also seeing employers now beginning to say, hey, wait a minute, we need to help our parents pay for that cost. So there is a bill at the federal level that would limit the amount of money that a parent would pay to 7% of their income up to a certain dollar amount. And it seems to be stuck at the federal level. It was going to be part of the Build Back Better bill. That died, and now there is a bill. Patty Murray and Tim Kaine have introduced a bill in the Senate that would provide more support for low-income families, but right now it seems to be stuck. At the state level, the governor has put in a lot of money for transitional kindergarten. These are programs for children who are age 4, and that all 4-year-olds will be eligible for that program free of charge to parents by the year 2026. Now, that's only a part-day program. It doesn't help working families particularly, but it might help some families. So we're still looking at that. But right now, if you're an employer and you've got families that need help with childcare, you see my little shared screen up there. I hope I see it, but I hope you can see it. But basically, you can go to our ccrcca.org/apply, and you can apply. It's about 3 minutes to fill out the initial form and get more help with your childcare. At the same time, we've got people leaving the field because of the pandemic and all that, and yet they were the childcare folks were the ones who were essential workers, along with the other essential workers, keeping everything going. And we paid for a lot of childcare for hospital workers and for all those Amazon drivers who were delivering our packages and the grocery people who were delivering our food. We were paying for their childcare, and we continue to do that to this day. And so we're also an employer. We have over 1,000 employees, and we are hiring. We figure we're going to need to add another probably 100 people over this next year. And now, after Daniel's presentation, I realize I'm going to have to pay them more. So that's just the way it goes. But we are one of the larger employers in the San Fernando Valley. That's not a hospital or the studios. So you can also go. If you're looking for a job, go online. We've got all sorts of jobs, everything from case managers to teachers to financial folks, HR folks. Everything is available to you. So I keep waiting for the buzzer to get off, but that's basically where we're at, Marianne.
All right. Well, thanks so much, Mike. Sounds like some good things are happening. Another area where good things are happening happens to be in accessibility toward high-speed internet. I think a positive thing that's come out of the last couple of years is the realization that everybody needs access to the internet. And it's the same as electricity, water, roads, all those things that we rely on in our infrastructure. So Adam Sharma is here to share with us the good news that's happening around the issue of high-speed internet accessibility. Thank you, Adam.
Thank you. I'm very happy to be here today. Good to see some of our existing partners, UCLA Health, Cedars-Sinai, a couple other folks sprinkled in there. What I like to start talking about when I talk about this is, why is it important, right? We understand during the pandemic, we understood it was important for school, for remote work, but now as things start to shift, well, keep shifting back and forth, I guess, as some of the previous panelists explained. Let's understand a little bit more about why it's important. We talked about, Karla talked a lot about mental health, right? I imagine that a lot of Karla's appointments happen through telehealth, right? That is something that is not, this video conferencing is not possible without high-speed internet at home, right? We talked about some workforce development. We talk about schools. We talk about some of the other healthcare implications. Our healthcare partners are starting to really understand what this means from a larger level, from personal health level. It's a lot easier to do preventative care, especially if you're access limited or accessibility limited, through telehealth, right? This reduces wait times in our clinics and in emergency rooms, right? This reduces the number of larger issues that we see. So if you can handle preventative care via telehealth, get a prescription, have something taken care of before it exacerbates and turns into something large, you save a lot on your medical bills as the patient, but also our system is able to be a little bit more robust in that sense. We talk about some other things, right? Operating a business. If you can't sell online, you have a bigger detriment to your business. It's a little bit harder to make the ends meet. So it's an opportunity that you don't have, right? And then access to benefits is another big one that we talk about a lot. I don't know if this is still true, but about a couple of years ago, the CalFresh application was about 38 pages long front and back, right? That is very difficult to do on paper, right? The digital application was much easier. You could stop, you can start over, and you didn't have to go in person until you finished that first application, whereas you never saw that 38-page document until you were actually in the office. And if you didn't have one of your supporting documents that you needed, well, you had to go back home and get it. Maybe you had your children with you. You had childcare that we just spoke about that you were paying for or that wasn't being covered, right? You missed out on a day of work. So people were hesitant to go on CalFresh, right? We actually have in California at that time, we had the second worst enrollment rate for eligible applicants for CalFresh in the country, behind only Mississippi, right? And access to technology was a piece of that. That was their strategy to improve on that. And I reconnected my folks over there and hopefully find out that things have gotten a little bit better. So I'll bring that all back around to Human IT. Who are we? We are a nonprofit. We are nationwide. However, we are based here in Los Angeles. And what we do is we provide equitable access to opportunity through technology. And what that means today is we provide low-cost computers, high-speed internet, digital literacy training, and tech support. So all that works and everybody can do all of that. We do that in California, mostly at no cost. So anyone can contact us in California and say, hey, I need high-speed internet. And we will direct them we'll check their eligibility, and then we'll direct them to the resources that are available to them. And I think some of them will be thrown in the chat here. I got some PDFs that I shared. So low-cost computers, obviously you need a device to access that high-speed internet and to use it to its best capabilities, right? So how many of you filled out your college applications on a smartphone? I know we did them on paper, but but how many of you did it on a smartphone, right? It's very difficult to fill out a college application on a smartphone. It's very difficult to write a resume on a smartphone. So we need that device in our homes, in people's homes, to be able to access those resources. Secondly, high-speed internet. A device is great, but if you're sitting in a McDonald's parking lot for their free Wi-Fi or a Starbucks parking lot, right, that's still not getting you what you need. That's not getting everything that we need at home. And then thirdly, the digital literacy training. Our digital literacy program is for people who really are not familiar or comfortable with a computer, right? So even if you go to a Target and apply for a job, stocking shelves or unloading trucks, they're still going to point you to a computer to try to fill out that application. If you don't have the knowledge to do that, that's going to be something that stands in your way of that employment. Additionally, that confidence is something that people don't have. If you don't have confidence in your computer abilities, you may not go to that resume workshop to make your resume better online, right? You may not go to that coding bootcamp if you want to reskill and change careers, right? So many of the resources are offered online. They were before the pandemic and they're even more so now. And so without access to all of those things, it becomes very difficult for us to do so. So summarize all of that, right? Low-cost internet, low-cost devices, digital literacy training and tech support. Human IT, we can provide all of that to your residents, yourselves, and the folks that you work. And we're happy to do so here. And I see some of these documents getting into the chat right now.
Okay, well, thank you very much, Adam. I sit in on a bi-monthly meeting of a consortium of broadband providers and so on that includes not only the IT companies like Verizon and AT&T and so on, Spectrum, but also city and county government representatives from Southern California. And they're all proactively working on getting people to sign up for affordable broadband access. There's funding available now for that. And there's a whole plan, and they're actually tracking how many people they've signed up city by city, county by county, as compared to how many potentially could sign up that could benefit and need this service. So some exciting developments in that area.
Glad to mention that. If I can quickly tag something
Oh,
I
yeah,
didn't
sure.
mention is the Affordable Connectivity Program is a federal subsidy which subsidizes up to $30 per month for your internet service and can provide through a qualified provider can provide up to $100 off a device. We're providers of that, as are most of the large ISPs that Marianne just mentioned. So please take advantage of that federal program, the Affordable Connectivity Program.
All right, thank you, Adam. Well, our last speaker, but certainly not least, is Brett Dickstein. And we know that, again, during the pandemic, many small businesses closed, but also many people were thinking about transitioning to a new career field and are thinking about or now planning or getting into starting their own businesses. So tell us more about that and how you can make that profitable.
Sure, thank you very much. Starting a business is the easy part. You know, you can form a sole proprietorship or a DBA or a limited liability company and get the tax ID and a DUNS number by yourself with $150 in your pocket. But having a product or service that's in demand, that people want, that generates enough revenue to cover costs and put food on the table and make enough to save, that's another story. So I think the goal is to create a company where folks are willing to pay for or subscribe for whatever you're offering, and to build a business that generates enough cash flow, right, to sustain the operation, and more importantly, generate positive net income, meaning you're making more than you're spending, right? So my main advice is to really look before you leap, right? First, you have to consider testing the R side of the R&D equation, right? That's the research. Do the research first before spending any money on building anything, right? Don't rent a shop, don't build a website, don't develop a mobile app. First, you got to do your homework. You got to survey the potential customers, ask your friends and family, get some insight as to whether you're onto something, ask around, gauge their reactions, see if anyone has an appetite for what you're proposing to do, right? And you have to also look at the market, understand what the competitive landscape looks like, what are the barriers to entry into whatever you're thinking about doing. And if you do that, you might gain confidence that if you build something or you offer something, that you can compete with others in the marketplace and you can attract paying customers, right? So if this research, the R&D side, if the research side gives you the confidence in your idea and it leads you to believe that you're onto something, then you have to solve the D side of the R&D equation, which stands for development, right? So you have to figure out what you need to do to develop the business model and bring that idea from your mind to the market. So if it's a service you want to offer, you have to figure out how to promote it and let the world know about it, right? Do you need to develop a landing page or an e-commerce website or social media handles in order to create channels to drive potential leads to your business? Determine what you can do yourself, or if you need to hire a freelancer to help you. If your research tells you that you need a brick and mortar space to offer your services, start looking around, work with a commercial broker, use LoopNet, try to find suitable locations. If you're developing a product for retail, right, figure out what you need to develop a prototype or a beta version, right? Do you need to hire an engineer to sketch out the design and the schematics? Do you need to source suppliers in the States or abroad? Do you have to find a contract manufacturer to get some samples built? Do you need to protect your intellectual property, by filing a patent or a trademark, right? So lastly, once you have a checklist of the things that you need to do, or maybe you've already got a business going and you have a list of things that you think you need to grow it, figure out what your budget is and how to pay for it, right? Unless you already have customers and sales that might move the needle for an investor or a banker, then expect to dip into your own pocket to cover the startup costs. That's for getting a minimum viable product or service ready to test commercially in the market. It means you need to figure out what you can and can't afford, right? You might need to tap your own savings or a credit card. That's sweat equity. putting in your own investment in there. You might have to ask friends and family to borrow some cash, do crowdfunding, or consider keeping your day job, right, which I think is a good idea, to earn your own seed capital to finance the startup costs until the business is financially sustainable. Right? So don't expect to find an investor or a lender in an early pre-revenue stage business that's going to fund what you need until you have a little traction. You can show proof of concept from your test marketing. You have some testimonials from happy customers, and you've begun to generate some revenue, and the magic number is usually around $5,000 in monthly recurring revenue. That proves that your business model cash flows and has the potential to pay investors or lenders back. Right? So hopefully this inspires you to do your research and look before you leap into starting a business. And if you need help brainstorming and navigating what to do next, if you have an idea or how to kickstart or grow a business you already established, or if you want to talk to someone about accessing capital or marketing or other areas of business development, then feel free to enroll in the Valley Economic Alliance's business advisory program. We've got pro bono, no cost, one-to-one consulting to help you kind of brainstorm. Hope that was helpful.
Very helpful, Brett. Thank you so much. And a good promo for Valley Economic Alliance and the good work that you're doing. I also want to say again, thank you to all our speakers. And having done a lot of public speaking myself, I know that it's really hard to condense your comments to 5 minutes. It's a challenge, and it requires a lot of thought about what high level stuff do you want to share with a group like ours. So thank you for taking the time to plan your comments and sticking to the schedule that our staff team set out for us, and for the good content, just great content that all of you shared today. It was really informative, helpful, kind of gave us a big picture look at what's happening in the Valley in terms of our economic development and security and so on. So with that, I'll turn it over to Sonya.
Thank you, Marianne, and everyone. And it does appear that we have a couple of minutes additional. If anyone would like to ask a question, raise your hand in the Zoom room, and we could probably take one, maybe two. But in the meantime, until I see those virtual hands going up, I will say that we've covered a lot of territory in this session, and I thank you all for your attention. You know, it's a great way to get a lot of ideas out on the table, but this is not the end, right? The idea is we're sparking a movement. We're just getting started so that people have a good overview of where to go. We talked about how our residents can be more healthy. We talked about the nexus between health outcomes and a person's economic situation, and the importance of being able to equip all of our residents to be able to be healthy physically as well as economically. Then we moved into some wealth strategies. We heard about some of the growing occupations that don't require exorbitant amounts of educational training, but they are competitive starting salaries with some growth potentials. We talked about where and what educational institutions are offering some of that training so that we have a direct pathway into those. And then we talked about some of the home buying programs that are available and grants. I mean, where do you hear that, right? These days, so many grants have dried up, but not only are there assistance programs, but there is a grant available from our partner bank, and we would love for you to be able to take advantage of that if you qualify. At least we can know about it and share it with people you think might qualify. So healthy, wealthy, and wise. You know, how do we steward our families in terms of childcare? How do we get access to high-speed internet? There's another great program that was presented from the federal government to really bring that within more people's reach, and entrepreneurship, which is kind of at the heart and soul of the Economic Alliance, and one of the things that we are historically have been very involved with, and into the future. We continue to be here for our local small businesses to help them access capital, market their companies, find new markets, find access to qualified employees, look at, find connectivity to real estate and how to leverage their real estate, and in general grow, increase costs, decrease costs, increase revenues, and operate in a more profitable way. So with that, I don't see any questions. And I think that it's been a very full day, a very productive day. I do want to encourage you all to stay involved with the Alliance. Again, the replay will be available at thevalley.net/healthy. And so you'll be able to find us there. You'll be able to find upcoming events, other upcoming events at thevalley.net/events. And I really want to thank Marianne and the whole Livable and Sustainable Communities Committee for all their great work on this and our housing campaign to promote development of housing. And I want to thank our expert panelists, as well as all of our attendees for joining us today. We are very excited about continuing to be a resource for our community and look forward to partnering with you for a more prosperous, environmentally sustainable, and equitable San Fernando Valley now and in the future. Have a wonderful day. Take good care, be well, and we'll see you at the next program.